heard from, and I don't know, maybe Dr. Lewis can answer this, we've heard from quite a number of specialists over the last number of weeks, and I guess if you were to, not to pit one group of specialists against the other, they all sound like they're having a hard time, but rheumatology, where would rheumatology fit in terms of, like, when we hear about heart disease and cancer, these are actually diseases we hear of people dying from, high mortality rates and that sort of thing. But rheumatology is something that a lot of Newfoundlanders and Labradorians, rheumatoid arthritis is something a lot of people have, but it's not a disease we hear people dying from. So, if you put that in context for us, where you sit in connection with other specialists.
I think that's a good point. However, there's not as straightforward as you think it is. See, most rheumatology diseases are what we call, for the most part, are living diseases. Okay, it's for most patients it's not a death sentence, but for a lot of patients it's a life sentence. And but on the other side of the coin is that if you have rheumatoid arthritis, okay, it's estimated by some specialists, some experts, that your life expectancy may be increased by up to 12 years, decreased by 12 years. So it's not purely a living disease. There is mortality associated with it, and so that's why again it's so important that these patients have the opportunity for optimal treatment, because if they don't, not only will they have damaged joints and disability, also the mortality rate will increase. But because it's a slow process, that I guess the public doesn't actually realize how serious it is.
And the other factor is that a lot of these patients, all of the patients, have to take medications, anti-inflammatory medications, and it's well recognized that patients who take these anti-inflammatory medications can end up with medical problems like gastrointestinal bleeds, and that can lead to death as well. And there's quite a number of people in Canada on an annual basis that pass away from bleeding to death, basically because of taking the medications. And then if you put it in perspective of daily lifestyle and being productive and being able to enjoy life or whatever the case may be, I think it's an incredible death sentence for these patients. And then they end up getting a joint replacement, but unfortunately if they don't get to us in a timely fashion, the outcomes from the joint replacement are significantly compromised, because you got to have a certain level of motion, etc., before you even decide to, or before you even you have to have a certain level of motion, say for example in the knee, that after the operation you'd like to see improvement. And usually when they're very stiff at the beginning, they may remain stiff afterwards, but again the pain is controlled. So there's a whole host of factors, and I would never pit one against the other, because I think everyone is equally important. All of our patients are important. We have patients that have rheumatoid arthritis, that have heart problems, that have issues with even mental health diseases. So they may even have all of the same things. So how can you say one is more important than the other? We could never do that as physicians.
And also another important point, Brendan, as well, is that you say about, I guess it's inferred that some of us, I guess the public, to a certain extent, doesn't take arthritis seriously. That's a fair comment. But not only is it the pain and the suffering and the mortality, but also it's the expense. The expense. The drugs that we use these days that are state-of-the-art medications, we're talking about up to $20,000 a year for these patients. And unfortunately, some of these patients are what we call the working poor. They have no insurance, and they don't have a Newfoundland and Labrador drug card. So they're sort of caught in the middle, and they can't get access to these medications. So not only is it the pain and suffering and the mortality, but also the expense to themselves and expense to the family. So it is, again, arthritis is a serious condition.